Question 1. A 67-year-old male is conscious and has a chief complaint of difficulty breathing. He is speaking in 2 to 3 word sentences, and his respiratory rate is 24 breaths per minute. Which of the following is the most appropriate initial treatment?
A.
High-flow oxygen via non-rebreather mask.
B.
Assisted ventilations with a bag valve mask. B.
C.
Supplemental oxygen via nasal cannula.
D.
Insertion of a nasopharyngeal airway. NPA. Answer.
A.
High-flow oxygen via non-rebreather mask. This question tests the initial management of respiratory distress with the keyword difficulty breathing and the clue speaking in 2 to 3 word sentences, indicating a significant problem but not complete respiratory failure. Because the patient is still breathing on their own at a rate of 24 breaths per minute but shows signs of poor air exchange, their sentences are short. The immediate priority is to increase the oxygen concentration they are inhaling, and the non-rebreather mask is the quickest way to deliver the highest concentration of supplemental oxygen. Assisted ventilations are reserved for patients with inadequate respiratory rate or tidal volume, the amount of air they breathe in, which is not yet indicated here. For example, if the patient's breathing rate dropped to 6 breaths per minute, that would require a bag valve mask. The takeaway tip is to always choose the highest flow oxygen device first for conscious patients with significant shortness of breath, unless their breathing is clearly inadequate. Question 2. A 35-year-old male complains of a severe headache and is confused. His skin is pale, cool, and clammy, and he has a medical alert bracelet indicating he is a diabetic. What is the most likely cause of his presentation?
A.
Hyperglycemic hyperosmolar state. HA.
B.
Diabetic ketoacidosis DKA.
C.
Hypoglycemia.
D.
Acute stroke. Answer. C. Hypoglycemia. This question tests the recognition of a diabetic emergency and the keywords diabetic, confused, and the physical signs of pale, cool, and clammy skin strongly suggest dangerously low blood sugar. Hypoglycemia occurs when the body lacks sugar, glucose, its primary fuel, causing the brain to malfunction, which presents as confusion and altered mental status. In contrast, high blood sugar, hyperglycemia or DK, usually causes warm, dry skin. A practical example is that if this patient were alert and able to swallow, a tube of oral glucose would be the indicated treatment because their presentation is classic for a sugar crash. Remember that cold and clammy, need some candy is a classic way to associate cool, clammy skin with low blood sugar. Question 3. During the primary assessment of a multi-system trauma patient, the EMT notes a rapid, thready pulse, delayed capillary refill, and pale skin. The patient's blood pressure is 92/60 mmHg. This combination of signs is most indicative of what condition?
A.
Neurogenic shock.
B.
Compensated shock.
C.
Decompensated shock.
D.
Cardiogenic shock. Answer. B. Compensated shock. This question is about recognizing the stages of shock, which is inadequate tissue perfusion, poor blood flow, and the keyword rapid, thready pulse along with a blood pressure that is technically still within normal range. 92/60 is not overtly hypotensive, are the key clues. Compensated shock is the body's early attempt to maintain blood pressure and vital organ perfusion by increasing the heart rate, rapid pulse, and constricting blood vessels. Pale skin, delayed capillary refill. Decompensated shock is when the body's compensatory mechanisms fail, leading to a significant drop in blood pressure, hypotension. For example, the patient's blood pressure would drop significantly, say to 70/40 millimeter of mercury, if they moved into decompensated shock. The takeaway is to recognize that a rapid pulse and signs of poor skin perfusion, even with a seemingly adequate blood pressure, are hallmark signs of the body actively compensating for blood loss or poor circulation. Question 4. Upon arrival at the scene of a motor vehicle collision, what is the EMT's first priority during the scene size-up?
A.
Determining the mechanism of injury, MOI.
B.
Requesting additional resources.
C.
Determining the total number of patients,
D.
Ensuring scene safety. Answer: D. Ensuring scene safety. This question tests the critical first step in all EMS operations, which is scene size up, and the keyword first priority makes scene safety the only correct choice. An EMT cannot safely or effectively treat a patient if the scene presents a danger to the patient, the EMT, or other responders. For example, if there are hazards like uncontrolled traffic, an active shooter, or a chemical spill. Prioritizing one's own safety protects the patient by guaranteeing that the person trained to help can reach them without becoming a second victim. Always remember, your personal safety and the safety of your crew are always paramount and come before all other patient care steps. Question 5. An 8-year-old child has fallen and has a deep laceration to the forehead. The child is crying, and the mother is present. What type of consent is required before providing care?
A.
Implied consent.
B.
Minor consent.
C.
Informed consent.
D.
Expressed consent. Answer: D. Express consent. This question is about the legal concept of consent in a pediatric setting, and the keyword mother is present is the critical clue because the mother is the legal guardian. Express consent, also called actual consent, is a clear, voluntary verbal or written agreement to an action, and it must be obtained from a parent or a legal guardian for a minor patient. Implied consent is only used when the patient is unconscious or otherwise unable to give consent. For example, if the mother were not there and the child was unconscious. If the child were conscious and able to talk, you would also seek their assent, but the mother's express consent is required for the treatment itself. The takeaway is that a minor patient always requires the express consent of a parent or a legal guardian unless a life or limb emergency dictates the use of implied consent. Question 6. What is the primary reason aspirin is administered to a patient experiencing chest pain consistent with a heart attack?
A.
To dilate the coronary arteries, improving blood flow.
B.
To reduce the workload on the heart by lowering blood pressure.
C.
To thin the blood, reducing the heart's pumping resistance.
D.
To prevent new clots from forming by inhibiting platelet aggregation. Answer: E. To prevent new clots from forming by inhibiting platelet aggregation. This question focuses on the pharmacology of aspirin in a cardiac setting and the keyword primary reason in the context of a heart attack. Myocardial infarction points to its effect on platelets. Aspirin is a platelet inhibitor, meaning it makes platelets less sticky, which helps prevent a clot from getting larger or a new clot from forming within the coronary arteries that are already partially blocked. It does not dissolve existing clots like a specialized clotbuster drug, fibrinolysis, would. For example, the patient is given nitroglycerin to dilate vessels, but aspirin is given specifically to address the clotting process. An easy way to remember this is that aspirin's main job in an EMT setting is to break up the clumpers in the blood. Question 7. When performing a primary assessment on an infant, the EMT should use the pediatric assessment triangle. Which of the following is not one of the three sides of the PAT?
A.
Appearance.
B.
Work of breathing.
C.
Circulation to skin.
D.
Level of consciousness. Answer: D. Level of consciousness. This question tests knowledge of the pediatric assessment triangle, PAT, a rapid, hands-off assessment tool for children, and the keyword not requires identifying the outlier. The three sides of the PAT are appearance, including tone, interactiveness, and gaze, work of breathing, including position and audible sounds, and circulation to the skin, including color. While the level of consciousness is part of the overall assessment, it is assessed within the appearance component, not as a separate side of the initial triangle. For example, a child who is listless and not making eye contact would score poorly on the appearance side of the PAT. Remember that the PAT is meant to give a quick, 3-point general impression without even touching the child. Question 8. A patient fell off a ladder and landed on their head. The EMT observes clear or straw-colored fluid leaking from the patient's nose. This finding is highly suspicious. For what condition?
A.
Basilar skull fracture.
B.
Mandibular fracture.
C.
Orbital fracture.
D.
nasal bone fracture? Answer:
A.
basilar skull fracture. This question addresses specific signs of severe head trauma and the keyword clear or straw-colored fluid leaking from the nose or ears is the classic sign of cerebrospinal fluid, CSF, leakage. This type of leakage indicates a fracture at the base of the skull, a basilar skull fracture, because the bone has broken and torn the protective layers around the brain, allowing the CSF to escape. It is important not to pack the nose or ears to stop the flow, as this can increase pressure inside the skull. Always treat any clear fluid from the head as a possible CSF leak until proven otherwise. Question 9. What is the correct technique for ensuring adequate ventilation when using a bag valve mask, BVM, on an adult patient?
A.
Squeezing the bag quickly and forcefully every 3 to 5 seconds.
B.
Squeezing the bag slowly over 1 second, with just enough volume to cause visible chest rise.
C.
Delivering a full volume breath every 2 seconds to hyperventilate the patient.
D.
Allowing a longer inspiratory time, inhalation, than the expiratory time, exhalation. Answer: B. Squeezing the bag slowly over 1 second, with just enough volume to cause visible chest rise. This question tests the essential skill of proper artificial ventilation using a bag valve mask, BVM, which is a core life-saving intervention. Effective BVM ventilation requires delivering slow, smooth breaths, approximately 1 second per breath, and only using enough volume to cause the chest to visibly rise and fall, which prevents forcing air into the stomach, gastric distension. Squeezing too quickly or too forcefully can cause the patient to vomit or increase pressure in the chest, reducing blood return to the heart. For example, a proper ventilation rate for an adult who is not breathing apnea is about 10 to 12 breaths per minute, 1 every 5 to 6 seconds. The takeaway is that slow and gentle delivery to achieve chest rise is the secret to effective, safe BVM ventilation. Question 10. A 72-year-old patient suddenly develops slurred speech, one-sided weakness, and facial droop. EMT should recognize this presentation is most consistent with what medical emergency?
A.
Transient ischemic attack, TIA.
B.
Acute stroke.
C.
Bell's palsy.
D.
Hypoglycemia. Answer: B. Acute stroke. This question assesses the recognition of a common, time-critical medical emergency and the combination of slurred speech, one-sided weakness, and facial droop are the hallmark signs outlined by the Cincinnati Pre-Hospital Stroke Scale. A stroke occurs when blood flow to a part of the brain is interrupted, causing brain cell death, and rapid transport is vital to preserve function. While a transient ischemic attack, TIA presents with similar signs, the key difference is that TIA symptoms usually resolve quickly, but the EMT must treat all acute symptoms as a major stroke, like quickly noting the time of symptom onset, the last known well time. Remember to think FASD. Facial droop, arm weakness, speech difficulty, and time to call 911/EMS. Question 11. During a mass casualty incident, MCI, an EMT finds a patient who is unconscious, not breathing, and has a peripheral pulse. According to the START Triage system, what color category should this patient be assigned?
A.
Red, immediate.
B.
Yellow, delayed.
C.
Green, minor.
D.
Black, deceased/expectant. Answer: D. Black, deceased/expectant. This question tests the application of the simple triage and rapid treatment, START, method, and the specific finding of not breathing but still having a peripheral pulse is the crucial component. Under START, an unconscious, non-breathing adult is immediately assessed. If opening the airway does not restart breathing, they are tagged black because attempting resuscitation delays care for salvageable victims. If the patient's breathing did restart upon opening the airway, they would be tagged red. For instance, a patient with a severe but controllable bleed who is breathing but walking would be tagged green. The takeaway is to know the START protocol, where non-breathing adults who fail an airway attempt are classified as expectant. Question 12. Which of the following vital signs is typically the least reliable indicator of early shock in a pediatric patient?
A,
Heart rate.
B,
Respiratory rate.
C,
Systolic blood pressure.
D.
Capillary refill time. Answer: C. Systolic blood pressure. This question focuses on recognizing early shock in children, and the keyword, least reliable indicator of early shock, is key because children compensate very effectively. Pediatric patients have strong compensatory mechanisms and can maintain a normal systolic blood pressure much longer than adults, often until they are on the verge of complete decompensation. Their heart rate will increase dramatically, tachycardia, and their capillary refill will be delayed as the body attempts to compensate, making these much earlier indicators of poor perfusion. For example, a child with significant blood loss might have a normal blood pressure but a very high heart rate and pale skin. Remember that in children, a drop in blood pressure is a late and ominous sign of impending circulatory collapse. Question 13. What is the only drug an EMT is typically allowed to administer or assist a patient in administering for an acute, severe allergic reaction anaphylaxis?
A,
Diphenhydramine, Benadryl.
B,
Albuterol.
C,
Epinephrine.
D.
Prednisone. Answer: C. Epinephrine. This question tests the EMT's limited pharmacology scope in a severe emergency, and the keyword anaphylaxis points directly to the life-saving drug required. Epinephrine is the only medication an EMT is commonly authorized to administer, often via an auto-injector, for anaphylaxis because of its dual action. It constricts blood vessels, raising blood pressure, and dilates the bronchioles, opening the airway. While the other drugs are used for allergic reactions, they are not EMT-level drugs for this specific immediate, severe reaction. A practical example is that if a patient cannot breathe after a bee sting, the immediate administration of their prescribed EpiPen is critical. Always remember that epinephrine is the first-line treatment for a severe allergic reaction, and its administration is a high-priority, time-critical intervention. Question 14. A patient has full-thickness burns covering their entire left arm and the anterior, front, trunk. Using the rule of nines for an adult, what percentage of the patient's total body surface area, TBSA, has been burned?
A,
9%.
B,
18%.
C,
27%.
D.
36%. Answer: C. 27%. This question tests the application of the rule of nines, a method used to quickly estimate the total body surface area, TBSA, of an adult that has been burned, which guides fluid resuscitation and transport decisions. In the adult rule of nines, the entire arm, left or right, is 9%, and the entire anterior trunk, chest, and abdomen is 18%. Adding these together, 9% plus 18%, equals 27% TBSA. If the entire leg were involved instead of the arm, the burn percentage would be 36%, 18% plus 18%. To apply the rule quickly, just remember that the head, each arm, and the neck are all 9%, while the front trunk, back trunk, and each full leg are all 18%. Question 15. A patient is experiencing a seizure that is lasting longer than 5 minutes and has not returned to a normal mental status between seizing episodes. This condition is defined as
A,
simple partial seizure,
B,
febrile seizure,
C,
status epilepticus,
D.
tonic-clonic seizure. Answer: C. Status epilepticus. This question is about recognizing a life-threatening seizure emergency, and the keywords lasting longer than 5 minutes and has not returned to a normal mental status are the classic definition. Status epilepticus is a medical emergency where a single seizure lasts more than 5 minutes, or when a patient experiences multiple seizures without regaining consciousness between them, and it requires aggressive management because prolonged seizing can lead to permanent brain injury. A single seizure that resolves on its own is typically a generalized or focal seizure. For example, a 1-minute tonic-clonic seizure is serious but not immediately classified as status epilepticus. The key takeaway is that any seizure activity that goes beyond a few minutes is a red flag for status epilepticus and requires immediate notification to the receiving hospital. Question 16. The structure responsible for the exchange of oxygen and carbon dioxide between the blood and the air in the lungs is the
A.
bronchus,
B.
alveoli,
C.
trachea,
D.
pleura. Answer: B. alveoli. This question tests basic respiratory anatomy and physiology, and the concept being tested is gas exchange, which is the primary function of the lungs. The alveoli are tiny air sacs at the end of the bronchioles where the wall is extremely thin, allowing oxygen to pass from the air into the surrounding capillaries and carbon dioxide to pass from the blood into the air for exhalation. The trachea and bronchi are simply the conducting airways that move air into the lungs. If the alveoli are damaged, as in emphysema, the patient will struggle to get oxygen into the blood. Remember that the alveoli are the business end of the respiratory system, where the actual gas exchange takes place. Question 17. An unconscious 45-year-old male with no suspected spinal trauma is breathing at a rate of 16 breaths per minute with adequate depth. Which airway adjunct should the EMT insert first?
A.
Nasopharyngeal airway, NPA.
B.
Oropharyngeal airway, OPA.
C.
Laryngeal mask airway, LMA.
D.
Endotracheal tube, ET. Answer: B. Oropharyngeal airway, OPA. This question tests the appropriate use of basic airway adjuncts and the keyword unconscious, alongside a potentially adequate breathing rate, suggests the risk is airway obstruction from the tongue. The oropharyngeal airway, OPA, is the primary choice for an unconscious patient without a gag reflex, as it mechanically lifts the tongue off the back of the throat to maintain a patent airway. A nasopharyngeal airway, NPA, is used when a patient is unconscious but still has a gag reflex or is semi-conscious and cannot tolerate an OPA. Since the patient is fully unconscious, the OPA is the most effective choice, but its placement must be preceded by an open airway maneuver like the head tilt/chin lift. The key takeaway is to always check for the presence or absence of a gag reflex before attempting to insert an OPA. Question 18. A mentally competent 58-year-old patient with chest pain refuses transport to the hospital, stating he feels better. The EMT must ensure the patient understands what potential risks before accepting the refusal.
A.
The EMT must get the refusal signed by 2 witnesses.
B.
The patient must understand the potential risks of refusing care, including death.
C.
The EMT must immediately call medical direction for permission to leave.
D.
The patient must be able to prove they have a ride to the hospital later. Answer: B. The patient must understand the potential risks of refusing care, including death. This question addresses a critical legal and ethical concept in EMS, refusal of care, and the keywords mentally competent and refuses transport highlight the patient's right to self-determination. Before accepting a refusal, the EMT must confirm the patient has decision-making capacity and has been fully informed of the immediate and potential consequences of refusal, which must include the worst-case scenarios like permanent disability or death. The EMT must document this conversation thoroughly, and obtaining witness signatures is a prudent step, but it is the informed consent/refusal process itself that is legally mandatory. For example, the patient must understand that a heart attack can worsen or cause sudden death, even if they feel temporarily better. Remember that you must clearly inform the patient of the risks to make the refusal legally informed. Question 19. What is the single most important intervention in the care of a patient in ventricular fibrillation VF?
A.
High-flow oxygen administration.
B.
Immediate initiation of chest compressions.
C.
Rapid defibrillation.
D.
Administration of an antiarrhythmic drug. Answer: C. Rapid defibrillation. This question tests the immediate priority for a pulseless cardiac arrest patient in a shockable rhythm, such as ventricular fibrillation VF, which is electrical chaos in the heart. Ventricular fibrillation is a life-threatening rhythm where the heart quivers uselessly, and the only definitive treatment is rapid defibrillation, which delivers an electrical shock to reset the heart's electrical activity. While chest compressions, CPR, are necessary to perfuse the heart and brain until a defibrillator is ready, the shock is the only treatment that can convert the rhythm back to normal. If the patient is not breathing and has no pulse, the sequence is: start compressions, attach the AED, follow the AED's instructions, and immediately continue compressions after a shock. The takeaway is that for VF, shock is key, and time is muscle because every minute delayed in defibrillation drastically reduces survival chances. Question 20. When assessing an elderly patient, the EMT should be aware that aging often causes a decrease in lung elasticity and a weakening of the cough reflex. What is the resulting primary risk for this patient population?
A.
Increased risk of hypertension.
B.
Increased risk of aspiration and pneumonia.
C.
Increased risk of traumatic brain injury.
D.
Increased risk of hyperthermia. Answer: B. Increased risk of aspiration and pneumonia. This question focuses on age-related physiological changes in geriatrics, and the concept being tested is how decreased respiratory function affects health. A decrease in lung elasticity, ability to recoil, reduces the effectiveness of breathing and coughing, and a weakened cough reflex makes it harder to clear foreign material from the airway. This combination significantly increases the risk of aspiration, inhaling food or liquid into the lungs, and subsequent pneumonia. While the other risks may also be present, they are not directly tied to the specific respiratory changes mentioned. For example, an elderly patient with a reduced cough reflex may silently aspirate a small amount of water, which then develops into pneumonia. The key takeaway is to be especially cautious about airway management and suctioning in older patients, especially those with altered mental status. Question 21. Which component of the secondary assessment is best described by the mnemonics DCAP-BTLS and is used to systematically check for injuries?
A.
Baseline vital signs.
B.
History taking sample.
C.
Focused physical exam or rapid full body scan.
D.
Ongoing assessment. Answer: C. Focused physical exam or rapid full body scan. This question addresses the systematic approach to trauma assessment, and the mnemonic DCAP-BTLS is the essential clue, as it is used to guide the hands-on examination for specific injuries. DCAP-BTLS stands for deformities, contusions, abrasions, punctures/penetrations, burns, tenderness, lacerations, and swelling, all things the EMT is looking for during the physical examination of a trauma patient. History taking uses the sample mnemonic, and vital signs are a separate, distinct component. For instance, the EMT would run their hands along the patient's legs, using DCAP-BTLS to find any deformity that might indicate a fracture. Remember that DCAP-BTLS is the blueprint for physically finding injuries during a trauma assessment. Question 22. Which of the following mechanisms of injury would warrant applying spinal motion restriction, SBAR, even in the absence of obvious signs of injury?
A.
A 6-foot fall from a ladder.
B.
A simple slip and fall onto an outstretched hand.
C.
A minor low-speed rear-end motor vehicle collision with no complaints.
D.
A sports injury with an isolated ankle sprain. Answer:
A.
A 6-foot fall from a ladder. This question tests the EMT's judgment on when a significant mechanism of injury, MI, alone dictates the need for spinal motion restriction, SR. A fall greater than 15 feet for an adult or more than 10 feet or 3 times the height of a child is considered a significant MI, suggesting a high potential for spine or internal trauma due to the extreme force involved. The clues are 6-foot fall and warrant applying SMR, which indicates a high-risk event even if the patient is currently asymptomatic. Minor falls and isolated sprains typically do not automatically require SMR. The takeaway is to treat all patients with a high-energy MOI, like a significant fall or high-speed crash, as if they have a spinal injury until they are medically cleared. Question 23. A 40-year-old female is experiencing a severe allergic reaction, anaphylaxis after eating shellfish. She is hypotensive, low blood pressure, and has wheezing. What is the primary reason the wheezing is a life threat?
A.
Wheezing leads to severe anxiety.
B.
Wheezing indicates swelling and bronchoconstriction, impairing air movement.
C.
Wheezing is a sign of underlying cardiac failure. D. Wheezing causes a rapid rise in body temperature. Answer: B. Wheezing indicates swelling and bronchoconstriction, impairing air movement. This question focuses on the pathophysiology of anaphylaxis, and the keyword life threat requires understanding the respiratory component of the severe reaction. Wheezing is caused by bronchoconstriction, tightening of the muscles around the airways, and swelling in the small airways, severely limiting the amount of air that can move into the lungs. This impaired air movement leads to hypoxia, low oxygen, which can quickly be fatal without prompt treatment, such as epinephrine. Hypotension is another major life threat in anaphylaxis, but the wheezing is the direct sign of airway compromise. A practical example is that a patient with severe wheezing and swelling of the tongue is rapidly losing the ability to breathe on their own. Always remember that the combination of breathing difficulty and signs of shock is the classic presentation of a severe, life-threatening allergic reaction. Question 24. What is the primary benefit of administering supplemental oxygen to a patient with adequate breathing but who is complaining of chest pain?
A.
To rapidly increase the heart rate.
B.
To reduce the patient's blood pressure.
C.
To increase the amount of oxygen supplied to the heart muscle.
D.
To dry up secretions in the lungs. Answer: C. To increase the amount of oxygen supplied to the heart muscle. This question addresses the therapeutic use of oxygen in a cardiac emergency, and the concept being tested is myocardial oxygen demand. Chest pain, angina, or heart attack often occurs because the heart muscle, myocardium, is not receiving enough oxygen, leading to ischemia, tissue injury. By administering supplemental oxygen, the EMT increases the oxygen concentration in the blood, which, in turn, increases the supply of oxygen available to the struggling heart muscle. While oxygen may be beneficial, its administration must be titrated to maintain an oxygen saturation, SpO2, between 94% and 99%. The key takeaway is that the goal of oxygen therapy in chest pain is to minimize damage to the heart muscle by boosting oxygen delivery. Question 25. An EMT arrives on scene and observes an overturned tanker truck with an unknown liquid leaking. Before approaching, the EMT should first use binoculars to look for the placarding to determine what key information?
A.
The closest hospital with a decontamination unit.
B.
The direction the wind is blowing.
C.
The potential hazards and required isolation distance.
D.
The type of fire suppression agent to use. Answer: C. The potential hazards and required isolation distance. This question tests the essential operational safety steps in a hazardous materials, hazmat, incident, and the keyword placarding is the critical clue. Placards contain the 4-digit United Nations, UN, identification number, which the EMT must look up in the Emergency Response Guidebook, ERG. The ERG is the go-to resource that immediately identifies the substance's primary health hazards and provides the necessary initial isolation and protective action distances. For instance, finding the placard number allows the EMT to know if the scene is an explosive, poison, or fire hazard and how far back to secure the hot zone perimeter. The takeaway is that scene safety, including consulting the ERG using the placard number, always dictates the safe distance from a hazmat incident. Question 26. When suctioning an adult patient's airway, the EMT should limit the suction attempt to no longer than how many seconds?
A.
5 seconds.
B.
10 seconds.
C.
15 seconds.
D.
20 seconds. Answer: C. 15 seconds. This question tests a key technique in airway management, specifically the duration of suctioning. Suctioning removes not only foreign material and secretions, but also oxygen from the patient's airway, and prolonged suctioning can quickly lead to hypoxia, low oxygen levels. Therefore, an adult patient should be suctioned for no longer than 15 seconds in any single attempt to minimize the interruption of oxygen delivery. For infants and children, the time is even shorter, 5 to 10 seconds. For example, if a patient is vomiting, the EMT should suction for 15 seconds, ventilate with high-flow oxygen, and then suction again if needed. The core guideline is to avoid prolonged suctioning to prevent serious oxygen deprivation. Question 27. A patient involved in a motorcycle crash complains of hip and groin pain. On examination, the EMT notes a shortening of the leg and a rotation of the foot on the injured side. The EMT should suspect which type of injury?
A.
Femoral shaft fracture.
B.
Pelvic fracture.
C.
Acetabular fracture.
D.
Tibia/fibula fracture. Answer. B. Pelvic fracture. This question addresses the recognition of serious lower body trauma and the keywords hip and groin pain combined with a visible shortening of the leg and a rotation of the foot strongly suggest an injury to the pelvic ring. Pelvic fractures can lead to massive internal bleeding because the pelvis is highly vascular, making this a life-threatening injury. While a femoral shaft fracture would also cause pain and deformity, the combination of hip pain and the specific rotation/shortening suggests the pelvis is fractured. For instance, the treatment for a suspected pelvic fracture includes applying a pelvic binder or wrapping a sheet around the hips to stabilize the area and control internal bleeding. The key takeaway is to treat any hip area injury with deformity as a potential life-threatening pelvic fracture. Question 28. A marathon runner collapses at the finish line. He is confused, has hot and dry skin, and his pulse is rapid and weak. The EMT should recognize this presentation is indicative of
A.
heat exhaustion,
B.
heat stroke,
C.
hypothermia,
D.
diabetic ketoacidosis, DKA. Answer. B. Heat stroke. This question tests the differentiation between environmental emergencies, and the key signs are hot and dry skin coupled with confused mental status. Heat stroke is a true medical emergency caused by the failure of the body's heat-regulating mechanisms, leading to a core body temperature that is dangerously high and an altered mental status. In contrast, heat exhaustion is characterized by profuse sweating and usually presents with pale, cool, and clammy skin. The priority treatment is immediate and rapid cooling of the patient. Remember that altered mental status and hot, dry skin is the classic, life-threatening combination that defines heat stroke. Question 29. When calculating a patient's Glasgow Coma Scale, GCS, score, a patient who opens their eyes only in response to a painful stimulus is given what score for the eye component?
A.
1,
B.
2,
C.
3,
D.
4. Answer. B. 2. This question tests the application of the Glasgow Coma Scale, GCS, a standardized neurological assessment tool, and the concept is evaluating the eye-opening response. The GCS is scored from 3 to 15, with 4 points for eye-opening. For a spontaneous, 3 is to voice, 2 is to pain, and 1 is none. Since the patient only opens their eyes to a painful stimulus, they are scored a 2 for the eye component. For example, if the patient opened their eyes only when the EMT loudly called their name, that would be a score of 3. Always remember the 4 categories for eye response and how to score them, as the GCS is a critical indicator of a patient's neurological status. Question 30. A patient with a history of heart disease is prescribed nitroglycerin. The EMT should know that nitroglycerin is contraindicated, should not be given, if the patient has taken a medication for what condition within the last 24 to 48 hours?
A.
High blood pressure.
B.
Erectile dysfunction.
C.
Diabetes.
D.
Asthma. Answer. B. Erectile dysfunction, ED. This question tests a critical pharmacological contraindication, specifically the interaction of nitroglycerin with phosphodiesterase 5, PDE5 inhibitors commonly used for erectile dysfunction. Nitroglycerin is a potent vasodilator, widens blood vessels, and combining it with ED medications like sildenafil or tadalafil can cause a synergistic effect, leading to a precipitous and fatal drop in blood pressure. The key contraindication is asking the patient if they have taken an ED medication within the last 24 to 48 hours, depending on the specific drug. The EMT must always check the patient's medication history before assisting with nitroglycerin. Remember that taking both is a dangerous combination that can cause severe, unmanageable hypotension. Question 31. What is the most common reason for EMTs to be sued in civil court?
A.
Assault and battery.
B.
Failure to obtain consent.
C.
Violation of patient confidentiality.
D.
Abandonment. Answer: D. Abandonment. This question explores legal liabilities in EMS, and the concept of abandonment is a frequent concern in legal cases. Abandonment is the termination of patient care without the patient's consent or provision for continuation of care by personnel with equal or greater training, which is a serious breach of duty. Common scenarios include turning over a patient to untrained personnel or simply leaving a patient who refuses care without properly completing the informed refusal documentation. For example, leaving an elderly patient with chest pain with a police officer who is not medically trained would be considered abandonment. The main takeaway is that once you begin care, you must remain with the patient until a proper transfer of care has been completed. Question 32. Which of the following is the most important indicator that an elderly patient may be a victim of abuse or neglect?
A.
The patient is confused or agitated.
B.
The patient lives alone in a poorly maintained home.
C.
The patient has multiple injuries in different stages of healing.
D.
The patient has a history of multiple hospital admissions. Answer: C. The patient has multiple injuries in different stages of healing. This question tests the ability to recognize potential signs of abuse or neglect in a vulnerable population, and the finding of multiple injuries in different stages of healing is the most compelling physical evidence. Bruises or fractures in different stages of healing suggest that injuries are occurring repeatedly over time, which is highly suspicious for ongoing physical abuse rather than a single accident. While the other options are red flags, they can also be explained by non-abusive causes. For instance, finding fresh bruises on the arms and an old, untreated spiral fracture on the leg is a significant indicator of potential abuse. The takeaway is to always consider abuse when injuries are inconsistent with the mechanism of injury or present in various stages of recovery. Question 33. The main functions of the nervous system include sensory input, integration, and motor output. What part of the nervous system is primarily responsible for integration?
A.
Peripheral nervous system, PNS.
B.
Autonomic nervous system, ANS.
C.
Central nervous system, C.
D.
Somatic nervous system, SNS. Answer: C. Central nervous system, CIS. This question addresses the basic functions of the nervous system, and the keyword integration refers to the processing and interpretation of incoming sensory information and the formulation of a response. The central nervous system, CNS, composed of the brain and spinal cord, is the body's control center where all information is interpreted and decisions are made. The peripheral nervous system, PNS, carries sensory information to the CNS, input and motor information from the CNS, output. If a patient touches a hot stove, the PNS sends the message to the CNS, and the CNS processes that information and sends a motor command back. Remember that the CNS is the command center for all information processing in the body. Question 34. What is the appropriate initial step when encountering arterial bleeding from a lower extremity wound?
A.
Direct pressure.
B.
Tourniquet application.
C.
Elevation of the extremity.
D.
Application of a hemostatic dressing. Answer:
A.
Direct pressure. This question tests the universally accepted primary step in external hemorrhage control, and the concept being tested is that external bleeding must be controlled immediately to prevent hypovolemic shock. Direct pressure applied firmly to the wound site with a sterile dressing is the first and most effective initial step for nearly all types of external bleeding. If direct pressure fails, then a tourniquet or hemostatic dressing would be considered the next steps, especially for severe, life-threatening, or arterial bleeding. For example, you would apply a thick dressing and press down hard on the wound while preparing other treatment options. Always remember that direct pressure is the simplest, quickest, and most reliable first intervention for controlling external bleeding. Question 35. A patient complains of sudden onset, sharp, stabbing chest pain that worsens when they take a deep breath. Their lung sounds are diminished on the left side, and the trachea is noticeably deviated to the right. This presentation is most suggestive of what condition?
A.
Acute myocardial infarction. Am I?
B.
Pulmonary embolism.
C.
Tension pneumothorax.
D.
Pericardial tamponade. Answer. C. Tension pneumothorax. This question requires the recognition of a life-threatening respiratory emergency and the combination of sudden onset chest pain, diminished lung sounds, and trachea is noticeably deviated are the classic triad of signs. A tension pneumothorax occurs when air enters the chest cavity but cannot escape, causing pressure to build up, which eventually pushes the mediastinum, including the trachea and heart, over to the opposite side, tracheal deviation. This pressure rapidly impairs breathing and compromises the heart's ability to fill with blood. Unlike a heart attack, the pain is often sharp and positional. The key takeaway is that tracheal deviation in a trauma patient is a late, ominous sign of a catastrophic tension pneumothorax.